The Open Therapy Institute is addressing bias in mental health care. Go to our website, opentherapyinstitute.org. We have CE credit workshops about overlooked issues in the field. You can go to our workshop page and register now and become a member. And for those looking for a therapist, we match people with someone who's highly skilled and truly open. Just contact us through the contact page on the website or email us at info@opentherapyinstitute.org. Hi, I'm Leslie Elliott Boyce, and I'm speaking with Dr. Andrew Hartz of the Open Therapy Institute. And this is another installment in our ongoing series of discussions for the Open Therapy podcast. And not conversation, the Open Therapy conversation is another thing, but I guess it's all one and the same, really. So we have had our last two recorded discussions. We talked about DEI and hitting at the heart of what is problematic, to use a word that's kind of trendy in DEI fields, about the ideologies that are being pushed and how they're being pushed. And we had a couple of discussions really breaking those down and some of the problems and the issues with DEI. And the response has been really good to those. A lot of people are really glad to hear rational but emotionally intelligent discussions about these problems that we just don't see talked about in plain language. We see a lot of different reactions to it. You know, we were just talking right before we hit record, and you're kind of describing this gamut from denial to overreactions, and so there's a different way of approaching it. And I think that a lot of people who've been listening have really responded to the discussions that we've been having in a positive way.
Yeah, it's been really great to see those responses. Yeah, I think that people are really hungry for an assertive but mature response to what's happening and the ability to talk candidly and directly about problems in a way that is, yeah, not avoiding the issue and not becoming unhinged in the other direction. And it's really, really hard for people. Um, this has kind of been coming up. We do have somebody, we just launched a journal at the Open Therapy Institute, and we're going to have our first issue out in a couple weeks. Really excited for that. But I remember going back to I feel like I talk about this issue far too much, and I think I do, but it was about about anti-white aggression, and it was that issue again, and just trying to say, would anybody write an article about this? And I can't tell you how hard it was to get anybody to agree to write about it. People just it's third rail. They can't touch it, but we did find somebody to do it, and I think it's going to be a fantastic article. I'm really excited for it. But I think the people who in the culture actually do talk about that issue tend to become very, very aggressive, and they're really angry, and it spirals. And I think it ends up actually preventing them from being heard, where talking about this impacts people's mental health. Let's talk about what's driving it and how we can understand it and how we can help in a balanced way. We don't need to be really angry, but we really shouldn't ignore it or minimize this issue. It's a big problem. And it's not just in our field, it's the whole country. It's just where are leaders who can say this is wrong? And we should care about this issue and respond in a mature, constructive way, but we need to be able to talk about this problem. And I look around the culture, and we can't do it. I remember and not to fault people who are trying to respond to it, because I think they're trying to do things that are effective. But I'll give you one example. I remember a lot of response to DEI based discrimination. Maybe this was a while back, maybe this was 2017 even, but it was well, you're helping minorities, but what are you doing for veterans? I don't know if you remember this kind of response, but it was kind of I'm all for veterans and making sure that they have great opportunities, but it's a bit of a non sequitur it's not really the issue. It's like, and so it wasn't really challenging to the DEI ideology in some ways because they're like, sure, we'll add veterans or whatever, and we'll continue to discriminate and we'll add veterans to it. And it's like it didn't really address the problem, you know?
Hmm.
And you would see how people would say, oh, the politicized ideology on campuses is really bad. Let's add more coursework about the founding fathers being great or something. And it's like, I think that's a bit of a non sequitur of like, yeah, I mean, that's sure. I think the founding fathers are probably underappreciated, and it's good for people to be aware of the Constitution. But that's not really a direct response to what's happening. It's like, and I still see like elected leaders and thought leaders cannot talk candidly and directly about anti-white or anti-male aggression as important social problems that need a response. There's basically, as far as I can tell, no national organizations with any clout that address this issue. And ideally, these would be institutions, I think, they could have bipartisan appeal. There are plenty of Democrats who could recognize this as an issue. I think they could be there. I know there are people in every racial group, religion, and ethnicity who think that anti-white racial aggression is wrong. There's lots of women who think anti-male aggression is wrong. There's like it can be a very diverse in every way group that is not hateful at all, that just says this is an issue that we need to talk about and respond to directly in a constructive way. And I don't know why those organizations still don't exist. I don't know why leaders still can't talk about that issue. And I think similar things happen in terms of like all the issues that OTI focuses on. If it's gender and sexuality, or maybe people can be more direct about censorship. Um, but it's just like I think people are really hungry for something that's assertive and mature on those issues.
As you're talking, I'm reminded of the dynamics that can develop in a marriage or in a just a personal relationship where there's an irrational and uncharitable perspective being taken by one partner, a pattern of behavior that is, we could categorize as abusive or gaslighting or these kinds of things. And then the other partner doesn't really know on what footing to object to that, but just has a problem with it. And you get this reactionary back and forth, and how helpful it can be to have that third person, somebody who comes in dispassionately in the middle and can kind of describe these patterns in a way that both people can see it from a sober, centrist, you know, intermediary position. And I think that that's been something that's been needed on both sides of this discussion as well, because you have the reaction and the action and then the reaction. And there's this sort of ping-ponging of dysfunctional, emotional response to this thing. And so having somebody who can come in, a group or just a new emergence of people who are able to look at it
Mhm.
and calmly describe, okay, here's what is really happening. And when you're talking about that, um, what did you call it? It was not really the correct response when you say, well, we're just going to add veterans in. What about veterans? And when you described this, it was like people who respond to DEI by saying it's a waste of money. Well, yeah, it's a
Oh
waste of
yeah,
money,
yeah,
but that's not
exactly.
really the problem. Sometimes it's hard when you're in an emotionally reactive place. You just know something is wrong, but you have a hard time articulating really why it's wrong. You,
They were afraid to say it.
hmm
And they thought this is a safer argument. And then
hmm
they'd end up losing and they'd be frustrated why they're losing the argument. They're losing the argument because they're not making the argument.
hmm
You have to say what the issue is. And you can do it in a way that's not aggressive, but you need to be direct.
hmm
And I think people really struggle with that. So they'd make a side issue about veterans, or yeah, it's
hmm
inefficient, or they'd use it's divisive.
hmm
Well, that's also not threatening because it's like, yeah, both side people disagree with this, but that doesn't mean it's wrong. Like you could have something that's good that bad people don't like, and then it's technically divisive, but so what?
Yeah.
But I think like what I going back to like the couples thing, that's exactly why I think like our field is so central to solving today's problems because this is what we do. Formulate what's happening, have a mature conversation about challenging issues in a way that's constructive and warm and empathic. That's the entire profession.
Mm-hmm.
That's what we do. So if we could take that skill and use it here, that's what can help people get to this place of, I think, a more honest, mature, and direct conversation. Um, but it just doesn't, uh, they need help. I guess it's like I think people really do need some guidance and some modeling and some advice about how to do this because I really do think they're struggling.
To build on that metaphor, and I really like what you're saying there, that is why this field, the psychology professions, has a really important role to play here. And I think that helps to sort of articulate why it was so shocking to me to have psychology professionals in education
Yes.
sort of speaking this DEI language, and why it's been so shocking to so many students and therapy clients and people in these professions or exposed to these professions, because it's sort of like the counselor colluding with one party in their dysfunctional behavior against the other party. It feels like that level of betrayal to have this field falling into that. So having people who are able to have sober and rational discussions to help right the ship, sort of create a compass,
Well,
is so important.
and not to be too harsh on the middle of the field, but like the inability of skilled therapists who have a conscience to do their job and t talk about these issues. They're afraid to for their own personal reputation for the most part, or they just don't want to deal with it. Maybe there's some laziness in there, things like that. But if we're going to tell our patients that when they have a problem with someone in their life that they should talk to them about it, we have to be able to show that we can do the same thing.
Mhm.
And it's really discrediting to the profession. Yes, I think there are some really aggressive people that have really taken outsized influence, but a big part of what enabled them to do that were good therapists who I think are good therapists and they're thoughtful people and they just don't want to take the personal risk. And the cost is that the field just becomes discredited. I mean, like thinking about going back to like the transgender treatment question, like people weren't asking what's the evidence base for the affirming care model for people with gender dysphoria or children. What's the evidence base? And to actually like be like writ large, our entire field didn't ask that question and get that answer is like, is it just that there's no professionalism, nobody did their due diligence, or is it like uh they're so timid that they can't even ask for evidence? And it's like that level of timidity is like a psychological problem. It doesn't reflect well on the field, and it's like not having integrity and not having the courage. And then how do we tell our parents or our patients to have integrity and to have courage when they talk about these things? We just can't. Uh,
Mhm.
yeah, I think it's so. I think that's really disappointing too, that there aren't more people who can practice what we're telling our patients to do, every day, and we're not doing it ourselves. So,
Mhm.
um, yeah, it's been incredibly. I still think that the practice in the profession works, and that if we apply it here, it will work. But it's been really a disheartening period.
Mhm. Mhm. And I think going forward, these kinds of conversations that you and I have been having and that other people have been having, they right now it feels like there's a space for that that's opened up that wasn't there a few years ago to the extent that it is now. It felt scarier to me to talk about these things when I started talking about them in 2022 than it feels now. And I don't think that's just because I've spent a lot of time talking about them.
Right.
For me in my life, I feel like the whole field is opening up where there's an ability to address these things straightforwardly in a way that we were as a culture having a hard time doing just a few years ago. And we've seen like these recent executive orders that are coming out that are talking about DEI. There's
Yeah.
a I guess a counter to DEI that's happening on a big scale right now. And so there's a new emerging ability to really address these. And I think that, when you said that in the field of gender care, I suppose, transgender psychotherapy for transgender people, this affirmative model, having no evidence base, a lack of evidence base. I feel like a lot of the things that we were being told within the DEI sphere were similar. Like they were presented not as here's an idea that we're warming up to, that we as a culture are taking on, and here's why. It was just sort of thrown out there as in this is the way we think now. And
Yes.
we weren't really given a chance as people who are being educated with this model to confront it at all, because within the model, it supplies its own rebuttals. This is your fragility speaking if you don't accept this, or you're a racist, or you're whatever. But
Right.
now that there have been voices that have really calmly taken this apart and examined it, we can continue to have a productive conversation. And I'm curious what your thoughts are about that conversation going forward.
Yeah, I think yes, you do we'll see what happens with DEI. It seems like a lot of these things are going to face issues in court and legal battles and will be at least they'll have to change shape if they're not totally uprooted. A lot of these ideologies will take a different form and it'll I think the fight will continue if I had to guess. But even just having them take a different form and have to retreat a little bit, there is this opening where we can have more conversations about a wide variety of issues that we haven't been able to talk about. My big worry is that people kind of see DEI, at least DEI in name, go away and they think, we won. And it's actually like now we have the opportunity to start the conversation on these issues. It's like it can start now because we don't have to self-censor, because people can actually listen to us now because they've maybe calmed down a little bit. And like we can actually like get through to people. So there's a unique opportunity to start a conversation and have a rich conversation about these issues. And I think like there's a lot that still needs to be said, and I really hope people don't hold back on it. Like, just thinking like about masculinity issues, like which is like I think there's so much there, and I think it's actually going to really be earth-shaking when it actually gets said and gets expressed. I think a lot of men look to their partner for permission about how masculine they're allowed to be.
Mm,
And they are afraid to express what their needs and desires are as men, because that could be seen as patriarchal or sexist or inappropriate. They're they're shy to express their limitations and what they want out of these relationships and to be candid and direct and to kind of to even let themselves be male in the way that they are and let themselves be themselves as men, um, sexually, emotionally, interpersonally. And that's a pretty deep part of the self to be suppressing like 24/7.
mm,
I think, and I think that's fairly common. And I think in a way, a lot of men have just numbed out to the fact that they're just kind of doing that all the time.
mm,
And they're just kind of used to it. And I think sometimes women are actually like missing this math, where to go, you know? And but it's there. It's actively being suppressed because a lot of men have been conditioned that they're not allowed to let that part of themselves blossom. And it's actually like can be such a like loving, positive, energizing, like comforting presence and power and that can really be good for everyone in the family. I look at a lot of dads now who have a very maternal approach to the children who, it's and I think that some of them, that may be who they are, and it's like be who you are, that's fine. Like I'm not trying to, but you know, um, I think a lot of men really repress that part of themselves. When that actually starts to come out and impact dating, impact relationships, impact the world, I think there's gonna be a reckoning there that's gonna be very challenging to work through. This isn't really like something that the legislative world can sort through, but
Mhm.
all the issues about masculinity and how men are coached to repress parts of who they are and how it impacts them and how it impacts relationships and how men respond. There's a ton of literature to be written here and even just be like reflected on and unpacked. And obviously, I think there's similar stuff on faith-based issues and a total like crisis of meaning, and people are so lost in terms of values. And then there's stuff about race that we've talked about, and other forms of. There's so many cultural issues happening, and it's like now that we can start to unpack what's happening here and like have the candid, authentic, sincere conversations that we've been prevented from having for so long. And I think a lot of this stuff is going to be really earth-shaking. Like it's going to be intense. We can do it, but we're just getting to a place where that conversation can really start, I think.
I think that the topic of masculinity is such a good one to zoom in on. And one of the questions that I have about this that I ask myself that I'm curious what other people think is how much is this DEI culture, whatever it focuses on, really a product of the dysfunctions that come with scaling up as a culture. When we've got this great plurality, we've got this need to manage more people, and you think about masculinity as a thing that's difficult to, I mean, just definitionally, masculinity is hard to manage. And
Right.
so you think about a classroom full of 5-year-olds and the boys are being, they're the problem because their energy level is too high. This has just been
Right.
a complaint that people have had for years and years, that little boys are disproportionately put on ADHD drugs, that they are the problem, that they get into trouble. If you're trying to manage 30 people and and the little, 3 or 5 of the little boys are bouncing out of their seats and getting into trouble because they're bored and they're climbing out of their skin, they're so bored, then you see them as the problem instead of seeing the scale that you're trying to work on being the problem. Whereas, as a homeschooling mom, I have 2 sons, and when they start to jump around and jump out of their skin, I can say, go run around the house a couple of times and come back. And, and it's fine. When you're working with an individual and you're working with them from a
Yeah.
loving perspective, then all the parts of them are just that's just part of them, and you work with that. You don't try to push that down and suppress it, but scale forces these kinds of dilemmas. And so um
Well, just to
yeah.
jump on that, I mean,
Yeah.
we've also systematically destroyed all male-only spaces.
Hmm.
Like male-only clubs are sexist, male-only anything is sexist, and they've been systematically, like, basically destroyed. There's
Hmm.
very, very few. And just having the right to be able to have a male-only space. I mean, the Boy Scouts aren't even male-only. And it's
Hmm.
like, so it's like that is a big part of it that boys are, and there are a lot more women only spaces. We preserved those. And there's a lot of girls' colleges and things, and there really aren't boys' colleges. And I think not that maybe most guys don't want to go to a boys' college, but I went to a boys' high school,
Hmm.
and and it was different. It was interesting. Three sports were required all 3 seasons. three sports, you know, and it was like probably really good for me, you
Mhm.
know. I mean, and but just like and it was just a different. I think I found like girls being around. Like once I hit puberty, I found girls incredibly distracting,
Mhm.
and it definitely impacted my school work in a negative way.
Mhm.
Um, and I did a lot better in a boys' environment. And there's just, yeah, um, just as one factor that like, and the other, it's like another thing to think about is the way that men are discriminated against so systematically. I mean, when BAs are going, basically 60% of BAs are going to women, and the crisis is there aren't enough women majoring in STEM. So bring more. It's like nobody cares about the men, and there are still lots of women-only scholarships, tons of scholarships and supports for women to go to college more.
Mhm.
And it's like, and so it's just obvious that like the disproportionate resources and the attacks on men, and if men do better at anything as a group, there it's seen as proof of their sexism, and then they're discriminated against and attacked to it. That demoralizes people. We can't try to do well at anything, or we're just going to be discriminated against and destroyed for it, and
Mhm.
blamed and shamed for it. So it's just like there's not any area of society where men are even allowed to have a strength or flourish in any way. There are lots of systematic ways that men are attacked, but it's even at the more subtle level of like what's happening when you date and
Mhm.
when you develop a committed relationship where there is this kind of like, am I allowed to be who I am as a man? And I think that's something that the maybe and I think it's interesting to me how many women are conflicted about it, where maybe they're attracted to a certain type of masculinity, but they think they shouldn't be. And, and like, it's very like, I think we talked about this in another episode where it was like, women, um, they take on the view of masculinity that it's this that it's dumb and toxic and like full of all these bad qualities and privilege, and it's this disgusting thing, and then they're baffled about why am I attracted to all these awful men, because they've just
Yeah.
kind of they brainwashed themselves into thinking that all these traits are negative, but clearly at an unconscious level they s- they can recognize something's attractive and powerful and useful about them. um,
Well, and
so
one of
it's
the
just
ways that this is really heartbreaking is in talking with young men who are really, really hate these parts of themselves. Really, I mean, when you talk about suppression of self in relationship, there's that happens in degrees, right? Like there's some degree to which that might represent something unhealthy, and then there's some degree of that's a normal part of compromise in relationship that we all undertake. But when it's a really deep self hatred or repression of parts of yourself, like just and this is just an anecdote, but like with my kids, I have four kids, two girls, two boys. My in watching them play, they're all of my kids were strongly artistic and creative, but my boys also had a love of destruction. They have a love of
right.
not just the building the beautiful gingerbread house, which they do very nicely, but then the absolute joy at getting to crush it with a rock when the season is over. It's
Right.
not like we're going to cry because we have to throw it away. It's no, we're delighted that we get to go and demolish it. And
Yeah.
so that destructive energy is so necessary because we need to be able to destroy things or take them apart sometimes in order to build new ones. And
Yeah.
I know this is an anecdote. It's not all girls don't like demolition, not all boys love demolition,
Right.
but
Right.
these kinds of parts of the self, like the ability to instead of rejecting one's aggressive impulses, manage them and master them and move through them somehow.
Well, I kind of, yeah, I see, I see there's basically like, I think of it as like there's a blockage in men
Mhm.
currently, for the most part, that's preventing them from being authentically who they are as men. I really think there's a block there. And then, they can go in front of it or behind it or to the left or to the right. They're going to go somewhere that isn't where they want to be.
Mhm.
And and some of it is to like internalize it and have shame and think that like men are bad and like I'm need to hate myself for being part of this bad group, which is maybe the DEI approach. And then, but then there's these other approaches. Like one of them is it's very superficial and performative, and it actually feels very hollow type of masculinity that's like no, like, for full disclosure, like I lift weights and I go to the gym. And so like obviously I don't think like just lifting weights and going to the gym is hollow. But I do think there are men for whom there's this performative thing about muscles where they're a
Mhm.
substitute for being authentically male.
Mhm.
And it doesn't quite feel sincere or it's not like compensating is usually like, oh, for their like penis anxieties or something, but it's like, no, like it's more compensating for the inability to truly be who they are as men.
Mhm.
I think is really more the way that I would think of it. But it can kind of hit the wrong key. It's kind of this fake, exaggerated thing. Or it could turn into another path too, is just boil over into resentment and just hatred of women,
Mhm.
rationalizing psychopathic behavior.
Mhm.
Um, it just could go in so many different directions where it's like not allowed to you're not allowed to be who you are, so how do you deal with that? And a lot of like, I think that authentic masculinity, it's not like, um, I don't have an image of like a super buff Alexander the Great, conquering. Like to me, that's not really necessarily what it looks like. It's real. It's just like more like, I think maybe it's more like our dads and our grandfathers' generation just had it. And it's like, no, they weren't lifting weights all the time, but somehow like they had like more confidence, more ease with themselves, more assertiveness, and
Mhm.
it was but in a genuine way that wasn't forced. I think that's really more what it looks like actually than the like some of it's kind of cartoonish and I can kind of tell they're grasping for the image of something that they haven't truly found in themselves,
Mhm.
which is just like being yourself is what being masculine is. And if you fully are that, you might be an artist, you might be whatever it is. And like, I think there's something very masculine about like a lot of painters who have done,
Mhm.
creative stuff, but it's like, it's not that weightlifting kind of
Mhm.
image per se. And
Well, and I think that when you talk about the sort of the suppression of masculine that turns into the hating of women, I mean, we've had these sorts of reactionary movements like Me Too, you know, that maybe some of that was addressing some serious interpersonal, intersexual dynamics, but it overcorrects. And so now you have women who think it's fine to hate men or call them all kinds of, associate men in general with these negative stereotypes. And that's very easy to do. It's very accepted to just disparage masculinity in men
yes,
and, and men who don't know how to approach a woman anymore because it's so fraught. Because, how am I supposed to, uh, I can't do it at work. If I come up to her at while we're out, then I'm a creep. I don't know how to actually engage with a
I
woman.
don't identify with that personally. I
You
don't
don't
think that is the same thing. I think it's easier to meet on an app,
on an
way
app. Yeah.
easier than
Well,
to
I do
approach a
hear
woman.
that, like young
Yes,
men who are have sworn off even having a girlfriend because it's not worth trying because they just sort of associate women with rejection and man hating.
that's interesting. But that does just show too the way that these social issues come into the therapy room and
Mhm.
in all these ways. And I do think there are positive avenues forward for those men.
Mhm.
And I don't know about their specific cases and how they came to those feelings, but let me say, just to kind of add to our controversial conversation here, like one thing that men, I think, care very deeply about that is super inflammatory. Okay. And like men care a lot about women's sexual pasts.
Hmm.
I really think that I don't have data on it. I just kind of from conversations I've had, it matters to them. If a woman has had sex with 1,000 guys,
Hmm.
it's much harder to like marry her
Hmm.
and like feel like I'm dedicating my life to this, my precious angel and whatever. And the more and women that I think a lot of women think that's a double standard and it's not intellectually fair according to like fairness morality standards, and yet it's in us psychologically, I think a lot of the time. And I'm not saying there's definitely something about like a very promiscuous woman that has a very high short-term sexual attraction to men,
Hmm.
but it's harder for them to emotionally invest in that woman and attach. And that's just I think that fact is hugely impacting society, and how men feel about women and how men connect to them, and especially if the woman has had a lot more sexual partners than the man.
Hmm.
Um, And then it's like, and I worry that there's kind of potentially a race to the bottom that nobody wants to be so much less experienced than the partner. So they have more experiences than they want, and it gets trivialized. And then maybe they have difficulty attaching because sex is dissociated from attachment and intimacy now. Or, I mean, these issues they need to be unpacked. I'm not super like dug into any of these claims, but like there's a lot of emotions going on around
Hmm.
these things. And there's an opportunity to start exploring them and try to unpack how they impact relationships, how they impact marriage and stuff, and how they impact how men feel about women. I mean, and it's like, because I don't think that women have the same sense of, uh, not that they don't necessarily care at all, but I don't think it cuts as deep.
I'm so glad that you actually said that because I think that's fascinating. And I love these kinds of discussions. There's always like all the caveats, not everybody, but
Yeah, yeah,
like you're talking in these
yeah.
general terms. I see that. And I think that one thing Jordan Peterson talks about a lot is the long-term versus the short-term mating strategy. Like you're talking
Yeah.
about that attraction to someone for a short-term sexual gratification versus thinking of somebody as a potential life partner, wife, husband.
Yeah.
And I think that the two sexes are actually more similar than different on this. And I would be interested in other people's feedback and thoughts on this because I think that there's kind of a hotness factor for somebody who's really desirable. So you imagine like the just something that you wouldn't take home to meet mom, but is really just very like viscerally attractive. I think that there's a visual perhaps element for men with women about that relates to that. And for women, I think that a man who has attracted a lot of women has a similar hotness factor, but also isn't necessarily marriage material because he's inherently sort of untrustworthy. And how would you feel special to him when he's been with so many partners or
Interesting.
has a lot of conquests in his past? So there's like an inability to see yourself being able to set up a life where you're special to that person and they're special to you. I think that both sexes, when they're thinking about long-term mating, there might be a little difference in terms of like how much sexual past a woman would find acceptable in her a prospective husband versus a man and his prospective wife. There might be a little bit of an asymmetry there, but I don't think it's that big an asymmetry. I think both people want their partner to have enough innocence left in them that they can feel special to that person, if that makes sense.
It does make sense. I think you might be underestimating how deeply
The
men
revulsion
feel
is for
about
men
this.
to
As
that.
yeah,
Okay.
but I do there it is interesting. Yeah, there is maybe more symmetry than I've given credit. Some of the evolutionary psychologists have done research on this topic and like
Hmm.
why it matters that like, because potentially according to the theory, like, the thing you don't want to do as a man is raise somebody else's child. So
Hmm.
you want a woman who's very like faithful to you, and that's very
Hmm.
important in a way where if a man is unfaithful to the woman, she's still not raising somebody else's child. Maybe the man is diverting some resources to this other child, so it's still a threat, but it isn't quite at the same level.
Hmm.
Um, from an evolutionary perspective. I don't know. I'm
That's
not
really,
sure if that's
I love it. I love it because it's, maybe we won't find a place where we're like agreeing on it, but I think it's
right,
really
right.
fascinating to sort of tease it apart.
Yes. And
And
that there's such taboo feelings and
yeah.
like, well, sorry, I cut you off.
No, no, no. It's okay. I agree. Yeah, it is taboo. It's hard to talk about these things, and I think this is one of the things that I think we lose when we're talking about everything at scale is the caveats start to overtake the heart of the matter for people. Like what's real becomes washed away in the attempt to sort of flatten it down to something that everybody can relate to or that appeals to the the very, I guess, average, like you average everything out, and now we have a meaningless discussion. And that's kind of what the DEI discussion ends up being. It's
Yes.
like the application of the average to the individual.
Well, the DEI, I mean, on the sexual conversations, I think these are heteronormative sexuality is like the extremely large majority of people. Like it's just like so
Yeah,
it's
that's
not
true.
even it's so overwhelmingly the common.
Mm.
I it's almost like the tyranny of these exceptions that you have
Yeah,
to kind of
you're
constantly,
right.
oh, well, what about intersex people? And it's like there
Yeah.
really aren't that many proportionally. And
Heteronormativity was the bad word in my human sexuality
yeah,
course.
it
Yeah.
was and
That's,
it's like,
yeah.
it's most people. But I think like just to take a step back to like what we're talking about, like how to open up the conversation
Hmm.
now that we can,
Mm.
where just to like reflect on some things about like, what's authentic masculinity look like? What are different ways that it can get derailed when they're not allowed to be masculine? What about male-only spaces and how they affect male development? What about male possessiveness and how does that impact individual relationships? How does that impact dating and social dynamics? How does that impact partner selection and the psychology of it, or people who withdraw from dating? What about anti-male bias? What about anti-male discrimination? Like, how does it affect women and confusing ways that they might relate to men? Just on the issue of masculinity and gender stuff in today's like the last 20 minutes, we've like there's a dozen topics
Hmm.
that could each be a full academic paper and could have many studies and literature reviews and topics on them. So like just today, there's that level of depth that we can go in. And we could pick one of these issues and really outline it and go into detail on it for each one of these. And I think that the danger to be like, oh, well, DEI is closing down, like it's like, no, no, no. All of these things need to get addressed. We now have a unique opportunity to put these issues on the map and start unpacking them and start addressing the myriad problems that have been ignored and compounded over the past decade. We have to talk about them. Um, and there's so much work that can be done. And I think like the biggest danger, I guess, aside from like thinking it's over if DEI closes or something, is being overly general and just kind of like I feel like my pet peeve is just like the therapists shouldn't be activists as like that article's been written a lot. It's important. I think it's true, but we're kind of on to phase two here. We need to like actually start exploring some of these controversial issues about masculinity and other issues. And that requires some courage to go deeper into them, to go into the particulars and to start unpacking what's there so that we can actually talk about things, um, even if DEI closes, it doesn't mean that these issues with masculinity are automatically just resolved. I mean, we really haven't even started to address them.
Mhm. I think it's a fascinating topic. I think that all of these do open up, like you said, myriad avenues for discussion that's really important because we're evolving as a culture. And sometimes that there's leaps and bounds that we make in terms of how we're interacting and how we're doing things together. Certainly, the internet and the interconnectedness of everything has changed us quite a bit. And there's ways in which that's changed how we interact that I don't think anybody really understands yet. And so there's room for all of these discussions and more. And just on the topic of masculinity, mating, dating, and how we feel about ourselves, how we express ourselves, how the two
Yes.
sexes interact. I think that, like you said, we could take that and make probably 10 different
Yeah,
really
yeah,
great
yeah.
podcasts out of it.
Oh my God.
So,
Yeah, and we
yeah.
should go into like spit, but it starts to actually get more interesting as you go into the depths and you think about dating culture and how it works and how those bad experiences can turn it sour into resentments and can sour into hatred of the opposite sex. And in a way, the more of them you have, like the more people can become closed off and bitter. And there's so many different things, so many different dynamics to unpack. And I think as they get fleshed out, then you start to see how much is not being ad addressed in our field and how
Mhm.
many issues are not being addressed. And all of these things are impacting our patients.
Mhm.
This is the other thing too. It's like these are all impacting our patients. And the idea of saying therapists shouldn't be activists, the number of therapists that are totally oblivious to this dynamic, it's like super high.
Mhm.
Maybe not the people that are listening to the podcast, but there are a lot who just like, and they're like, oh, I don't kick my patients out for being Trump supporters. So I'm doing a great job. But they don't know anything about these dynamics. They're totally clueless. When they see them, they miss it. They don't have any empathic response. They don't have anything to say. It's like there's so much to be done. And I think when we do bad work on these issues and with these populations, it just further alienates people from the field. People who really do could really benefit from a place where they can have these conversations that, are harder to have with strangers,
Mhm. Mhm.
in particular. So,
Well, thank you for being willing to dive in and do this series with me. I really enjoy it. I think people get a lot out of it. And for people watching, we do read your comments, and please feel free to give us your feedback on this or anything else. We want to see what people are thinking, and I really like responding to comment. I wish I had more time to sit and respond to people, but perhaps we can bring a couple in if people raise things that are, um, that are really good fodder for discussion. So
yeah.
please do comment. And Andrew, did we miss anything? Do you want to cap it off
Oh, we miss
before we
so much.
close?
I mean, that's the whole thing. I mean, and it's like, I'm interested in like for people who are more in the therapist world, like an object relations lens or a classical Freudian lens or a CBT lens, to really start to think about, or an evolutionary psychology lens, and really start to think about these issues, applying our theories to this. I even was like, we should just have like a wheel. And it's like one of the wheels is like different theoretical approaches, and the other wheel is like these different topics or something, and we just spin them, and then wherever they line up, that's the podcast. And
Yeah.
it's like, it's like there's hundreds of things to be written and explored. And I hope my guess is that people are really impacted by these things too. And if they were just like, yeah, I should write about what happened with my divorce because it was related to this stuff. It's like, yeah, that might be interesting. Or what I saw in my patient, or it could be a personal experience or
Mhm.
something you observed, but there's just so many people. All of these things I think are really, really, really impacting people. And so we just need to kind of start connecting the dots so that we can do the work.
Absolutely. I like the wheel. Wheel of Fortune.
Leslie, spin the wheel.
Yeah. Excellent. Well, thank you,
Yeah,
Andrew. It's great talking with you, and I'll
thanks.
look forward to the next time.
Thanks.